Hi, this video is the before and after hair transplant restoration surgery, and it's early in the morning. It's around 5 something, 6 in the morning, so he looks tired. But anyway, he's thinning from the front toward the back, and we will be doing around at least 25 or 3,000 for his frontal area. He's thinning, and we create his hairline. And hair transplant, as you know, it requires a lot of artistic and aesthetic detail to ensure very natural result. It's not just taking hair from the back and slap in the front and pray that it will grow out. The hairline nowadays is very precise. When I create the hairline, I want to create it naturally for each individual. So, and as long as proportional to a third, from the eyebrow to the hairline is a third, from the mid glabella tip the nose a third, tip the nose bottom chin's a third. And we can zoom in closely and just eyebrows and up. Perfect. So from the eyebrow to the hairline, on average for Asian and black is 6.5 to 7. For Hispanic it's around 7 to 7.5, and Caucasian is 7.5 to 8.5. Now we use the average ethnic hairline as a guide, but really when we build the hairline, we build it according to each individual facial structure. So for this client, actually initially I put around 6.5, but then considering that we need a lot of hair, so his can go up to 7. So what we're doing right now from the mid eyebrow to the hairline, so 7 centimeters, as you can see. Again, from here to here is 7 centimeters. And then, so while we did the measurement, and from the midpoint to the temple, if we don't bring the temple in and just lower the hairline, he's gonna have a really wide forehead, and it's looking very abnormal. So what we do is right now his temple on the side hairline have receded back to 11 centimeters. So we did a mark right in the middle here, and then we measure from here to here should be 7 to 8.5 max. So we got to 8.5 centimeters here, and from the midpoint to here is 8.5 centimeters. And you can see his forehead is pretty has receded on back, so it's pretty wide. So we brought it to 8.5 centimeters and turn this way for me. And again, it's very thin backwards, so we bring it back into 8.5 centimeters. And so if you look down, see how thin his head is. It's all the way front to the back, and it's going to be a multiple process for him. But the patient really, due to financial constraint, he's willing to work the front half first and work our way toward the back. With this type, you can get away with 2 or 3 surgery, but doing at least 2,500 to 3,000 is the way to go. Besides getting the shape down, we had to transplant at a very precise angle. Start around 35-45 in the front, and increases when you go backward and changes when you go different direction. When on the sides, it's flat against the skin and backward. The precise angle is important. The selection of hair grafts is important. We transplant rows and rows, single hair graft in the front, followed by root to go 2 hair, 3 hair, and 4 hair in the back for bulk and volume. And so this is the art of hair transplant restoration surgery on a Hispanic man who has a class 4 or 5 hair loss pattern, a very advanced hair loss pattern. And he will do one video in the Spanish too, by himself. And so please follow him. In 8 months to a year, you can see the progression, and he will document a day later and a few days later to see what this healing like and what all this the process of hair transplant like. My work will be very natural, and the density, of course, it will be there. It's I'm excited for him because in 8 months to a year he will look fantastic. He told me that it really affected his self-esteem and self-confidence. Losing his hair. So once we do this, it will look completely different. He will do one again in the Spanish, so just follow him, and then in a year's time we're going to do another follow-up video. Okay, thank you.